Assalamu alaikum. Today we will be discussing the infectious disease that is named malaria. Malaria is a protozoal infection caused by protozoa, and the carrier in the case of malarial infection is Plasmodium. This is the diagram of Plasmodium. This is normal cell, and this is the cell which contain the infectious material and which is causing the infectious disease that is malaria. What is the cycle of malaria? First of all, the infected mosquito, which is female Anopheles mosquito, then it is a vector. Female Anopheles mosquito first bite a person that is not infected. When the mosquito bite it got infected and the infection spread to the liver. In liver, RBCs formation occur, so the infection also spread to the RBCs. Now, when a free mosquito bite a person with this infection, it got this infection in its gut, and when the mosquito bite another person, this infection is spread to another person, and in this way this cycle continues. Female Anopheles mosquito is vector. It injected in form of sporozoites. Sporozoites go to liver and affect RBCs. RBCs destruction occur, which leads to hemolytic anemia. In result of hemolytic anemia, bilirubin is released in the body, which is unconjugated bilirubin. So, when the unconjugated bilirubin is present in the body, it will lead to jaundice. Due to the presence of unconjugated bilirubin, abnormality is developed, which is known as jaundice. Now, what are the symptoms of malaria? First of all, jaundice will be developed as there is mesohemolysis of RBCs. Due to the hemolysis of RBCs, anemia will occur in the body. There will be deficiency of red blood cells and hemoglobin. Due to the deficiency of hemoglobin, there will be no transport of oxygen and the patient will feel fatigue. There will be deficiency of hemoglobin and increased production of WBCs as it is infection disease. So, to fight the infection, the body will produce more leukocytes and white blood cells to fight the infection. Now, what are the types that cause this malaria? The most common types are P. vivax, P. ovale, P. malariae, P. linevolsi, and P. falciparum. Plasmodium falciparum among the all types cause the most severe malaria. It also known as black water fever, as there is massive destruction of RBCs and it affects all stages of RBCs formation. For example, normoblast, reticulocyte, etc. Plasmodium falciparum is causing the hemolysis of RBCs and it is affecting all the stages of formation of RBCs. Now, what will be the clinical features with which the patient of malaria appear? Most common features will be headache, malaise, body aches, weakness, high-grade fever, vomiting, cerebral malaria when affect brain. Plasmodium falciparum affect cerebellar area, and cerebral malaria also can appear when the species is Plasmodium falciparum. As a result of cerebral malaria, coma and delirium may develop. Now, some species may remain in liver as latent for years, so specific medicine is given. The species that remain in the liver are Plasmodium vivax and Plasmodium ovale. One of the feature is excessive night sweating. The fever will be very high in morning and fever occur at alternate days. The scenario which can come in exams on this case will be having features of high-grade fever, unconsciousness, toxic, delirium, coma due to cerebral, high fever 3 to 4 days, jaundice, HB decrease, platelets will be normal, WBCs will increase, there will be meningeal irritation signs positive because of P. falciparum. Plasmodium falciparum affect the brain area. Hepatosplenomegaly, acute infection and latent organisms in the liver. Latent organisms in the liver will be found in case of Plasmodium vivax and Plasmodium ovale. Now, how to confirm the case of malarial infection? We will investigate. First of all, Giemsa stain, thick and thin film is taken of blood. Thick stain is to detect the malaria plasmodium. To detect there is malaria plasmodium or not. Thin smear is taken to show the type of which species is present, whether it is Plasmodium falciparum, vivax, or oval, etc. Immunochromatographic rapid diagnostic tests are done for the confirmation, for example, optimal or parasite. Optimal is done for P. falciparum and P. vivax, as it has its LDH enzyme, which can be detected through immunochromatographic rapid diagnostic tests. Parasite F is done for histidine-rich protein. QBC malaria is a diagnostic test, and this detects fluorescein microscopy-based malaria antigen. DNA of protozoa is checked through PCR. These are the symptoms of malaria: headache, fatigue, nausea, vomiting, chills, fever, and muscle aches. These are the most common and general symptoms of malaria. Now, what treatment is provided to the patient of malaria? First line of treatment is chloroquine drugs. Now, there is the different stages of malaria. It is known as mild malaria, severe malaria. For mild malaria, the treatment is CO artemether. Tablets only are used at 0, 8, 24, 36, 48, and 4 hours period. Quinine is used 3 times per day. The dose is 600 milligram and it is given for 5 to 7 days. Plus, doxycycline is given along with quinine, and if malaria is the case in pregnant lady, then clindamycin is used in the case of doxycycline. Severe malaria. Artesunate 2.5 mg per kg intravenous is used at the odds difference of 0, 12, 24. It is given once in a day for 7 days. Orally, 2 mg per kg can be given, and if it doesn't work, then quinine is used in severe malaria. Let's come to the scenario. What question will be given in the exam? A 25-year-old male patient has had series of hospital admissions for recurrence of malaria in the last 8 months. On latest admission, he made an uneventful recovery, was discharged from the hospital. What prophylactic drug with dosage and duration should be given to him for prevention of recurrence of malaria? What hematological investigation would you advise before starting this patient on the prophylactic drug? Name malarial parasite against which the prophylactic drug is effective. A 30-year-old farmer was brought to the A&E department with history of high-grade fever with rigorous aches and pains. The patient has been bitten by mosquito and has been passing black-colored urine since 2 days. As we discussed above, that the Plasmodium falciparum is also known as black water fever. So here we are having the history of black urine. He was pale-looking, mildly jaundiced, had mild splenomegaly with no hepatomegaly or lymphadenopathy. Remember, whenever there is the discussion of cerebral brain damage or symptoms of coma, delirium, unconsciousness, or there is history of black urine, then we can differentiate the scenario. This is Plasmodium falciparum. Plasmodium falciparum is different from the other species, and that's why it is given more in the exams as compared to other. Here we have completed our topic. If any questions, you can